Coming up on the Doctor's Hospital podcast.
I can tell you some drugs cost up to almost $40,000. And to get a copay waiver off of that or to get 30% off of that is a humongous save.
Your health just got brighter with Lamp Insured. Sign up for our Lamp Insurance Supplement Plan and enjoy copay waivers and complete access with no upfront ER or inpatient collections. Only $30 per month. Visit doctorshosp.com/lap to sign up or contact 822-1009. Your journey to affordable and worry-free healthcare begins now.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director here at Doctor's Hospital, and I am excited today to be joined by representatives of our LAMP team. I'm here to talk about the Doctor's Hospital Loyalty Advantage Membership Program. So joining us today on this episode of the podcast is Laniqua Sands, who is the LAMP representative here at Doctor's Hospital, and Rashann Symonette, who is our LAMP brand ambassador. You might know Rashann from her face and I guess maybe her voice when she comes in from some of the commercials that we've done at Doctor's Hospital over the last few years. But welcome to the show, both of you lovely ladies.
Thank you for having us.
So for our listening audience who may be unaware, what we want to do today is kind of just dive through some of the nuances of what LAMP is, what it offers, how it differs from insurance, just kind of, what it looks like overall to give our listeners an understanding of what LAMP is and how it can benefit them. So let's start with the broad strokes. Rashann, can you provide us with an overview of the Doctor's Hospital Loyalty Advantage Membership Program and some of its key objectives?
Sure, Alexis. So LAMP is Doctor's Hospital flagship membership program. With that, it allows affordability and accessibility to all facilities at Doctor's Hospital. With this, it also allows us to reduce the out-of-pocket costs of outpatient care services. It offers free preventative and wellness care benefits. And for those who are insured, it provides additional supplement with copay waivers.
Okay. You mentioned affordability and accessibility across the health system. Obviously, the Doctor's Hospital landscape has changed a lot over the last few years. I always like to tell people when I came in 2019, we had two facilities, and it was the main campus and Doctor's Hospital West. And now we have a laundry list of facilities across New Providence, Grand Bahama, and Exuma. So the LAMP program provides access across all of the locations.
All of the locations.
Okay. All right. So what inspired the creation of LAMP, and how does it align with the hospital or the health system's mission and vision and values?
Well, Dr. Diggis, who is our CEO and president, was the brains behind LAMP essentially.
Mm-hmm.
And he saw LAMP as an opportunity to make quality healthcare more affordable for the general public.
Mm-hmm.
And with that, it aligns with the hospital's mission and values because we've taken the complaints of the general public with healthcare being expensive,
Mm-hmm.
and we've been empathetic to essentially create a plan that helps to facilitate and cut the cost of these services that you would typically get at a private healthcare system.
Mm-hmm. And obviously with We Care being our core values, it kind of aligns with that idea of
Yes.
caring, not just caring for the community, but also providing access to that quality care. So I know a question that I hear a lot as I go out into the world and people ask me about LAMP, and I often, kind of have difficulty navigating how to answer it fully. But a question that pops up a lot is, how does the Loyalty Advantage program differentiate from insurance? Because I think a lot of people look at it as a question like, okay, should I just have LAMP? Should I have LAMP on insurance? What does it look like? What makes the most sense? So how does it differentiate from what people would commonly refer to as major medical insurance?
Great question, Alexis. So LAMP is not an insurance plan. We are a medical healthcare plan that more offers affordability. It's less expensive
Mhm.
than health insurance. We know that health insurance can be very, very expensive. And like Laniqua stated, we wanted to create a plan that everyone can afford and still obtain that quality care at Doctor's Hospital. And then also, persons like this plan because they don't have to go through the long process of insurance as well,
Mm-hmm.
in terms of even being accepted on the insurance. LAMP is for everyone, no matter the age, no matter the pre existing conditions as well.
Mm-hmm.
So it is for everyone. The answer is never no when it comes to if you can sign up for LAMP.
Okay. Um, yeah, I imagine that that part about pre-existing conditions and age is a particular one, and then ease of sign up is also, I imagine, a sticking point for people as well. So obviously LAMP has been in existence now, I think, for going on 3 or 4 years roughly. Um, and obviously during that time you'd have a lot of different people who have utilized the program, who signed up for it. Can you kind of talk us through some of the patient success stories of people who have benefited from the program? Like I have one, but I'll let you start and I can tag mine on in the end.
Yes, I can. So we usually have many patients who call and talk about how LAMP has helped them tremendously in a more financial aspect.
Mm-hmm.
So, for example, imaging services. We all know that imaging services at doctors' hospitals is very expensive. So when they have the opportunity to get free imaging or discounted labs, pharmacy, things of that sort, that can run them into thousands of dollars.
Mm-hmm.
The ability to get that at a discounted rate or for free, depending
Mm-hmm.
on the plan, they basically share how it helps them in a great way.
Okay. Rashann, you want to add to that?
Well, definitely, especially working in the clinical space, in the hospital, in the clinics as well. We see it every day. I can tell you, we've had patients for pharmacy alone.
Mm-hmm.
That 20% co-payment or that 30% discount for the prepayment plan goes a very long way. I can tell you some drugs cost up to almost $40,000.
Mm-hmm.
And to get a co-pay waiver off of that or to get 30% off of that is a humongous save
Right.
compared to the monthly membership plan of either $33 or $44. So it's a really great save.
Right. So I imagine if you're on insurance and you have a specialty medication that runs you into that $40,000 per how much of a time frame that you're on it for, um, at the 20% that you would be
That's about
typically
8,000.
right, you'd be typically responsible for, which is $8,000, to have that waived altogether, I imagine it's it's definitely swings in the favor
That
of
definitely.
the 30 or 40, like you said, the 30 or $40 a month that you would pay in order to get access to that benefit. So like I know for me, when my mom got diagnosed with cancer a few years back, um she was on LAMP, and we were able to utilize LAMP to get, because at the time she wasn't insured, but we were able to get access to those two free imaging scans during that process to really help us quickly get through diagnosis and figuring out what was going on. So like I said, even for me, from my family's experience, we've benefited from utilizing LAMP. And that's not specific to me because I'm a staff member. It's just because this is the way the program works and the plan works. So you kind of touched on it a little bit, but I wanted to go a little bit deeper into the benefits. So can you kind of talk through some of the benefits of the LAMP program as it pertains to things like imaging, lab, pharmacy? Like get into some of the nitty-gritty details of what those discounts or those benefits look like.
So definitely, I'll start off with the insurance supplement plan.
Mm-hmm.
So that plan basically offers you copay waivers.
Mm-hmm.
When your insurance approves, LAMP approves. So for medication, for lab, for imaging, normally the copay range either 20% or 30%. You don't have to worry about that at all. We will take care of that cost for you. It's almost like you're even covered at 100% because
Right.
your insurance pays that 80 and we will cover that 20. And when we talk about percentage, you don't know the range of where that is going to land
Right.
because it's not a set amount. It's a percentage of a particular charge, and health services can be very costly.
Right.
So that 20% might sound small, but that can go a very, very long way. As it relates to the prepaid primary care plan, we have imaging that we give you 2 free imaging per year.
Mm-hmm.
That's your X-ray, your ultrasound, your CT, or your MRI,
Mm-hmm.
and they can be very costly. You just mentioned those as well.
Mm-hmm.
We have prescription medication at 30% discount. That's even more than seniors. Seniors only get 10%.
Right.
So to even get 30%, that's a really, really good deal right there. And then, of course, your lab, 30% off your total charges for labs. And labs can be very costly as well, just as much as prescriptions as well.
Right.
So
Okay.
some pretty good plans there.
All right. Um, moving into then kind of the overall impact of having something like this plan. Um, what in what ways does the Loyalty Advantage membership program contribute to improving patient outcomes, and then the overall quality of their healthcare?
So, one of the greatest ways in which LAMP contributes to improving patient outcomes and overall healthcare is that it makes quality care more affordable and more accessible,
Hmm.
and namely preventative care. We know that prevention is the best cure to anything. And one of the ways in which this is executed is when patients get to develop personal relationships with their physicians.
Right. Right. So I imagine if you have someone who is on LAMP, I think the idea is that they will more consistently engage with their physician. So they're more likely to get the annual done on time. Obviously, we send reminders for people during the month when they're supposed to have their annual done. But the idea is that, by engaging with the physician on a regular basis, you become more
Yes,
comfortable, and maybe something that you wouldn't say if you're seeing a physician for the
for the
first
first
time,
time, right?
you might feel more comfortable if you already been to see Dr. So and so, 3, 4, 5, 6 times. Then the idea is you become more and more comfortable with explaining, well, I have this little thing that I haven't really told anyone about, that sort of space, which obviously, if you're going to provide that information, then you're giving you're arming your physician with more information to give you proper diagnosis, proper care.
And then let's not forget, our members do not have to worry about costs, especially on the prepaid, because the primary care visits are free.
Right.
So that's something, if they know that they can get an appointment today, tomorrow, next week, and it's for free, if something is going on with them, they feel comfortable enough to go ahead, book that appointment, especially when they have that rapport with their physician.
Hmm.
They're going to go to see their doctor.
Yeah, because they're more likely to go at the first sign of something rather than wait around and be like, oh,
Definitely.
do I have the how much ever dollars it is to go in and go to
Yeah.
an urgent care
They don't have to
facility,
worry
or
about that.
right. Okay. I mean, that makes sense. Um, so obviously it sounds like, this is a plan that most people would be interested in. So what strategies do you employ to promote and communicate the Loyalty Advantage program, its benefits, sign up, all those sorts of things to patients and potential patients, and how do you encourage enrollment?
Well, from inception, we have been getting in communities. I'm
Hmm.
sure many persons have seen us doing pop ups, doing
Hmm.
the healthcare fairs. We partner with different organizations as well. We have podcasts. We, get into the social media space as well. That's where a lot of people are. Even online, sign up is relatively easy. I
Hmm.
must say, it only takes about 2 minutes to sign up, and you can pay when you are ready as well. Even in terms of getting in contact with our staff members, the phone lines, we always answer them. The emails, we tend to answer them right away as well. So we are always available and always trying to get the word out about LAMP as well. And this is something we don't just want you to sign up and pay for it. We send you the reminders to get your annual visits done. We book those appointments for you. So we want you to utilize the service as well, so we can help you get quality healthcare and better healthcare moving forward.
Okay. I guess in that regard, I can say personally, so obviously from the role I sit in, I see a lot of the different, health fairs, career fairs, blood drives, pop-ups, community events, all of that sort of stuff. And I think, I don't know that there's been an event that we've done in a community space that hasn't had the LAMP team present and available to do signups for, from the junior baseball league to, even corporate events, like having engagements with places like Ocean Club, Harmar, um even I think we did Margaritaville at one point. So I know the LAMP team has been all over the place, both in New Providence as well as in Grand Bahama, facilitating promotion and education on the program. um so you mentioned sign up, you mentioned what that process looks like. What all would somebody need if they're going on the website to sign up, what all information should they have handy in order to be able to sign up for LAMP if they wanted to go and sign up today?
Well, it isn't really much that's needed. Basic demographic information. So your name, date of birth, uh, email address, NIB numbers. Of course, you would have to choose the plan that you want to enroll into.
Hmm.
And if for any reason you're enrolling into LAMP Insured, for insured persons, you would have to identify the insurance carrier that you're registered with currently. And so that we'd be able to verify. And that's just about it.
Okay. So another question I had was, I think you both mentioned in varying degrees how easy and simple it is to sign up for LAMP. I imagine one of the questions that people may have is, what is the turnaround time between me signing up and then getting an indication that I'm approved as a LAMP member, whether it's on the insurance plan or the prepaid plan?
So the turnaround time is typically around 2 days or less. Usually after you would have registered, we would send it. You would get an email confirmation sent out to you,
Hmm.
and then you would get a personalized email depending on the plan that you choose, talking a little bit more about the benefits and how you can make payment and the different modes of payment. So
Okay.
all of that is usually done between 2 days or less.
Okay. And then once I'm signed up, is there any like wait time before I get to access my lamp benefits? What does that look like?
So after your initial payment, there's a wait period of 30 days where you won't have immediate access. So after that wait period is completed, then you would have full access to your benefits.
Okay. All right. So let's pause for a quick word from our sponsors, and we'll pick back up with our lamp team, talking about all things loyalty advantage membership program. We'll be right back.
Are you uninsured and seeking a plan that can give you quality health care at discounted rates? Unlock affordable health care with LAMP. Enjoy unlimited primary care visits, exclusive discounts of up to 20%, and complimentary imaging and nutrition services. Visit doctorshorse.com/lamp to register. Comprehensive, cost-efficient wellness starts with LAMP.
So we've talked through all of the different benefits that LAMP offers. We've talked about imaging and lab and pharmacy, nutrition consults, all of these different things. And obviously, I think one of the big questions that then pops up, and it might sound like an obvious answer, but you have to ask it to make sure that it's clear for our listeners as well. Where all can I use LAMP? Like, can I use LAMP at places that are not doctor's hospital? Can I use it at the imaging center? Can I use it? Where all does that? How does it work?
So, LAMP benefits can only be utilized at Doctors Hospital, and that's Doctors Hospital Nassau and on the Family Island. So, yes,
Okay, and that's any location in the province
any location
or across the health system, basically.
across the health system, Doctors
All right. So I
Hospital.
know we've talked about a few um of the plans that are available. I don't think we've spoken just directly to, okay, these are all the plans that are available. So can you walk us through what are the different plan options for LAMP, and then how do those work? So I think we've gone through the insurance and the prepaid primary care. What other plans exist and how do those work?
So we do have our LAMP NHI, and this plan is specifically for our NHI members. Uh, NHI is free,
Hmm.
which is a great benefit. However, we said for our members who come underneath Doctors Hospital, we want to give you something a little bit more.
Right.
So it's a lot of benefits under the LAMP NHI plan.
So for clarity, before you continue, this would be someone who is signed up for NHI under a doctor's hospital facility.
Yes.
This is not if you have NHI outside of our space. All right.
Correct. You
Right.
have to be signed up underneath Doctors Hospital with our physician, whether here in Nassau or on the Family Islands.
Gotcha.
It is for all our NHI members. And with this particular plan, of course, on the NHI, you get your free clinic visits and your labs. But we say, let's give you a little bit more. We're going to throw in a mammogram for you once per year. We're going to give you one free imaging services, whether that's X ray, ultrasound, CT, or MRI. Even with your medications, we said we're going to give you 15% off of the medications as long as you are an NHI member.
Hmm.
And then also you get 2 free nutritional visits. So that's
Okay.
pretty good.
Okay. And then what about I guess customization? So I imagine that, LAMP for businesses may sound like an opportunity to add to their like compensation and benefits package. what type of opportunities exist in the space of, both offering LAMP just as it currently exists to businesses at a group level, as well as the potential for customization of LAMP to fit a very specific need for a business.
So, definitely, just like individual insurance, group insurance is also expensive. Many businesses out here cannot afford group insurance, but LAMP is also a great alternative for those companies. We have companies now who are signed up with LAMP as an employee benefit at the same prepaid primary care plan or even a customized plan that is more suitable for their employees. So that is also an option as well. And we welcome each and every business out there to give us a call, let us customize a plan for you, or even if you find fit that the LAMP prepaid primary care plan is beneficial to your staff, we can sign up your staff with that. And it's easy. We do all the paperwork for you, and your staff will just enjoy the benefit.
Okay. Um, so what does the future of LAMP look like? Are there any additions on the horizon? Is there anything else that people can look forward to in terms of the expansion of the program, new benefits, new service offerings that it covers? What does that look like? And where do we see LAMP heading into the future?
So there are definitely plans that we intend on implementing in the future. So, like Rashann would have mentioned previously, creating customized plans for business establishments. And we're also looking to possibly introduce our LAMP Ultimate plan in Nassau. It currently only exists in Grand Bahama, and this plan includes urgent care as well as all of the other benefits that you would receive having LAMP with us.
Okay.
I wish I was living in Freeport to get that LAMP Ultimate.
And that urgent
Listen,
care.
that's a plan. That's the plan to be on.
Yeah.
Because many persons in Nassau, they ask, are we bringing the ultimate plan here?
Hmm.
It was like, no, it's specifically for Freeport. So we jealous of y'all, Freeport. We
Mhm.
jealous.
And obviously, at the time when LAMP Ultimate launched, we only were offering urgent care in Grand Bahama. So we're at a place now where, with Doctors Hospital West opening up and operating urgent care, and with a few potential other urgent care sites along the way. I can't spill the beans just yet. There may be sufficient opportunity in that space now where we can offer LAMP Ultimate to the residents of New Providence as well.
Definitely.
All right. Having had a very expansive conversation on LAMP, the benefits, where you can utilize it, all of those different things, the different plans that are available, I think the big question, the last elephant in the room, is how does somebody go about signing up for LAMP or contacting the LAMP team if they need more information?
So sign up is done online. You can visit our website, doctorshosp.com/lamp. And located on the website is additional information about LAMP, some frequently asked questions, as well as our enrollment form. So once you enroll yourself, you're good to go. But if you need additional assistance, you can contact us at 822-1009, or you can contact the LAMP Help Desk at 302-4635.
Awesome. So I want to thank both of you ladies for joining the podcast today and walking us through all of the different aspects of the LAMP program. So thank you to Laniqua. Thank you to Rashann.
Thank you for having us.
Thank you.
And we look forward to seeing all of our listeners signing up for LAMP if you've not already done so. It is an amazing program that you can take advantage of to, again, like our intent is to make it more affordable and more accessible. So as always, I want to thank our listeners for joining us today on the podcast. We encourage you to like, comment, subscribe, and share on all of our social media platforms. And we look forward to seeing you next time on the Doctors Hospital podcast.
Let's face it, life is hard, but your healthcare doesn't have to be. Give yourself a peace of mind with LAMP plans at Doctors Hospital. Sign up today and enjoy the low-cost advantage. Get up to $5,000 in credit limit for non-covered services and 2 free nutritional consultations. Choose your plan today by visiting doctorshos.com/lamp. We make healthcare easy.